Yan, marami pa ring libre dito sa ating bansa mga kasambahay. At syempre, isa nga sa mga libreng makukuha po natin ay yung impormasyon na pwede nating matutunan mula po sa ating mga nagiging panauhin dito sa ating segment na Usapang Pangkalusugan. Mahalaga yan para po maiwasan natin ang pagkakaroon ng sakit. Kaya binibigyan talaga natin ng oras at tamang pakikinig ang mga natin topics. At ngayong umaga, syempre, in line pa rin po sa naganap na anniversary celebration po natin, Elder Empowerment. Ayan, pag-uusapan na po natin kung paano nga ba dinidetox ang ating mga lolo at ang ating mga lola. Ngayong umaga, kasama po natin ang nag-lose sa maraming weight. Ayan, kanina nga nagtataka ako sa kanya dahil I wanted to ask kung ano yung ginawa niya, kung bakit siya nag-lose ng weight. Dr. Lily ko. Good morning!
Good morning, Lynn. Good morning sa ating mga kasambahay and good morning to all of the viewers of UNTV.
So refreshing Yeah. Isa po siyang Integrative Specialist, mga kasambahay. At pag-uusapan nga natin yung pangangalaga, pag-detox ng ating mga elderlies, yung ating mga lolo at lola. Kaya umpisa na natin ang ating katanungan. Ano nga po ba ang importansya, di ba, ng pag-detox, lalong-lalo na ng mga elderlies? Marami ba silang toxins sa kanilang katawan na kailangang i-flush out or ilabas?
Yes, importante sa mga matatanda, sa mga elderlies to do their detoxification also. Kasi kadalasan marami sa kanila ay constipated. Now, constipation is one of the most important symptom na kailangan iayos. Hindi porket, hindi lang okay lang na every other day or something. Kasi nga, more often than not, pwede siya maging symptoms ng another disease coming in. Especially if they have hypertension or they have diabetes, you have to worry na they are not moving their bowels every day. Importante yon. And more often than not, kadalasan, dala ng pagkulang sa inom ng tubig.
Tama, totoo yan. Minsan hindi natin nabibigyan ng importansya yung number ng beses ng pagdumi ng isang tao, lalong-lalo na ng mga elderlies. Para kasing feeling ng mga matatanda, parang regular lang na hindi na sila regular dumumi. Masama pala yun,
Yes.
Kasi supposed to be every day, naglalabas ka ng dumi. So pag hindi mo na ilalabas yan, i-stuck siya sa katawan mo at yun ang nagiging lason.
Meron tayong sinasabing auto-intoxication, paglalason sa sarili. Kasi what goes in must come out. And then lahat ng kinain natin should come out of the system within 48 hours. Kung hindi, magkakaroon ng auto-intoxication nga. Yung dumi na naiipon dun sa intestines, yung sa blood vessels, bumabalik sa sistema. At ang unang nalalason ay ang liver. That's the reason why you said you have to love your liver, take care of your liver.
That's right.
Because that's where all of the metabolism goes. At pagka hindi maganda ang sistema ng liver, a lot of problem comes in.
Alarming na pala yung 2 araw. What more, may mga kilala ko 3 araw, 4 na araw, hindi sila dumudumi. Hindi pa naman din sila elderly.
The highest record in my clinic is 3 weeks.
3 weeks?
Yes.
Lola, ito, anong age?
No, she wasn't even only an 18-year-old.
Wow.
And it's really mind-boggling how she could make tiis for 3 weeks.
3 weeks, Tapos yung dumi na yan yung umiikot ulit sa katawan natin.
And then the reason why she came to the clinic is talagang hindi na nakakaisip.
Ala. Ayan. Okay, baka kaya hindi tayo makaisip or baka kaya dapat intindihin natin yung ating mga elderlies kung bakit nagiging ganun sila. Minsan kakulit or minsan mainitin ng ulo. Ilan ba yan sa mga simptomas, Doc, na marami kang toxin sa katawan? Ano ba yung iba? Mainitin ng ulo?
Mainitin ng ulo, hindi nakakaintindi, ayaw sumunod, makakalimutin. And then, often din not kasi, ang nasa isip na, konti lang naman ang kinain ko, okay lang na walang nilabas, mali yun.
Mali yun.
And then, when we say they have to take in lots of fluids, pag sinabi nating fluids, it's tubig, hindi siya iced tea, hindi siya Coke, or whatever, mga soda, hindi po pwede. Water is water. Importante na matupad nila yung 8 glasses of water. Right now, during summer, 8 glasses is not enough. Especially, sinasabi mong tag-ulan ngayon, it's still summer because the heat is still there. And the more it rains, the evaporation from the earth is a lot more. So you have to take in a lot more water. Kasi yung sinasabi nilang alimuom, it's really very bad for your system, especially for the elderlies.
Kaya ba minsan malalaki din yung tiyan ng mga hindi dumudumi palagi, lalong-lalo
Yeah.
na ng mga elderlies, no? Kasi napapansin ko yan, minsan payat na payat sila, pero
Pero
malaki
malaking
yung
tiyan.
tiyan nila. Kala ko naman malnourished sila. Ibig din sabihin, marami silang toxins sa
Marami
kanilang
silang
mga
dala-dala na
tiyan.
hindi na ilalabas.
No.
And one of the things na simple lang na kung as long as they're not diabetic, no, you could mix apple juice with extra virgin olive oil.
Wow.
And then just have it before bedtime, makatulong. Kung diabetic naman sila, and it's a good practice that when you wake up, you take 4 glasses of water
I heard that.
with a little bit of lemon.
With a little bit of
That's good for flushing. And before bedtime naman, you take at least 1 tablespoon of extra virgin olive oil.
Okay, wait. Kasi maraming mga apple juices na available sa market right now. Merong matamis na matamis, may konting tamis. Ano ba ang the best na bilhin na apple juice
Correct.
para masigurado mo yung flushing na gagawin ng katawan, lalo ng mga lola at lolo?
Can I say the brand?
No, siguro, yung ano na lang,
It's
di ba?
M.
Oh, okay, alam ko na yan.
Yeah.
Pero 100% pure
Pure
yan.
siya. But if you have a juicer, you could just make your own apple juice.
Tapos yung olive oil, ganun karami talaga siya.
1 tablespoon.
1 tablespoon.
But if you're going to mix it with the apple juice, it's half a glass of apple juice with half a glass of extra virgin olive oil. And for sure, it's going to flash you.
Ang daming olive oil.
Yeah,
Half a glass.
It's going to
then-
taste like vinaigrette lang naman eh.
Ganon.
Yeah.
Okay, and this is you do it before you go to sleep.
Before you go to sleep.
And then the next day you drink water.
Just water, 4
With
glasses
lemon.
of water
4
with lemon.
glasses.
And it's going to flush out.
For
That's a
that.
basic thing.
Okay. Meron pa rin tayong susunod na katanungan. Ano? Yung mga seniors po natin, gano'n naman sila kadalas dapat nagde-detoxify? Kasi yung sinabi niyo about yung sa pagdumi, almost every day.
Yeah.
Pero sa ibang paraan na madi-detoxify yung mga katawan ng mga lolo at lola, is there another way or another method na yung ibang toxins sila mailalabas din nila?
Ang nakakatakot kasi sa environment natin ngayon is we cannot take away the toxins of the air and the water.
Yeah.
So make sure that you're drinking water. Tapos sa air naman, for when you go out, wear a mask, especially if the elderly is coughing. Kasi it's either they're asthmatic or they have an infection. Wearing a mask could protect themselves from additional infection or for them to give the infection to others. Now, within the environment naman sa kabahayan natin, it's best, in my clinic, I do suggest for people to use aromatherapy. The essential oils will help, especially if you have an infuser. The oils is placed in the water, it's infused in the air, nakakatulong dun sa environment, cleaning of the environment as well as the respiratory system of the elderly. Kasi yun ang more often than not na magiging sakit ng mga matatanda is either respiratory or digestive.
Oo. Doc, yung naman na-mention natin kanina, yung detoxification through yung pagdumi ng isang tao. Pero may isang way din po ng detoxification na sinasabi nila sa pag-iyi naman ng tao. Ngayon, ang tanong ko kasi, how do you get to know na talagang nagde-detoxify yung katawan mo pag nag-undergo ka ng detox? Meron ka bang mapapansin sa wiwi mo, sa dumi mo, pag nagdi-detox ka na usually hindi mo naman napapansin? Para masigurado kasi baka nagdi-detox ka, tapos hindi naman pala nadi-detox yung katawan mo. So how do you get to know na talagang natatanggal yung toxin sa katawan mo?
Number one, there could be changes in, like for example, in bowel movements is more than your usual. And then sometimes you would know that there's detoxification happening because the color also changes.
Yeah.
May mga pagkakataon na yung kulay ng dumi naging green.
Opo.
And that means to say that the gallbladder and the liver were flushed out.
That's good.
And that's a very good
So
sign.
that's a good sign. Okay.
And then pagdating naman sa urination,
Yes.
there could be change also in the transparency.
Okay.
Nagiging malabo.
Okay.
It means to say mayroon kang nilalabas na mga buhangin or whatever toxins, or sometimes there is even pus form that comes out. If that happened, it's really quite mind-boggling.
So, tsaka yung color niya parang medyo
Minsan
brownish, no? Yung color.
Pag brownish, ibig sabihin there's something wrong with your liver.
Okay. So, dapat malabo lang siya. Walang greenish, walang brownish.
Wala.
Malabo lang siya. Tapos, pagka-detox ka na, clear yung urine mo.
During the detox process, there could be some changes in color. But as you go along, it should clear up.
It should clear up.
Yeah. And then if you use the right type of water, it's really going I have reports from my patients that they pass out sandy materials.
Oo. Ayan, yes, Dr. Lee, may katanungan siya.
I'd just like to ask, no, kung yung mga green tea, is that good for elderly if they want to use it as a detoxing aid? Especially yung mga elderly natin, doktora, na mahilig na dati sa kape.
Yeah.
So, pwede
Yan,
nilang
nagpapalit.
substitute yun for
Green.
coffee, yan,
Yeah.
mga tea.
One thing about green tea kasi, you have to know where the green tea comes from.
Right.
Kasi there is parang sa market, nag-ano lang, green tea. And the one that has the greatest detoxifying effect is that from Japan. It's either the matcha and the sencha green tea,
Yeah.
which is really green. Kasi there are some supposedly green tea in the market, but yet they're colored brown.
Yeah.
Diba?
Kasi sinasabi nila, Dok, di ba pinatutuyo daw, kaya nagko-color ng brown. Kaya dapat green, pag green
No,
tea.
the real green tea is really green tea.
Okay.
And then yung matcha nga, which is the best but it's a little bit expensive, it can take out pati yung cholesterol mo.
Oh, that's
Yeah.
good.
That's the reason why yung the Japanese, especially the ladies, they're thin. It's the one that they use for the tea ceremony, the green one. That's the best.
Saka maraming mga lumalabas na ngayon ng mga slimming teas, di ba? So,
Can be good for your skin, di ba?
Yes.
Yeah,
But
that's one.
ang problema lang kasi sa green tea, some of this green, there's what we call the yin and the yang
The yang,
thing. It's something that is cold or if it's hot. Pag nagkataon na yung katawan ng pasyente, ng elderly, medyo on the weak side, he cannot take too much of this green tea because it's going to make him weaker. That's the reason why, pag ganyan na medyo weak, you could substitute what we call the ginseng tea.
Ginseng
Which is
tea.
warmer, especially pagka... But you don't take ginseng tea during summer.
yan.
Kasi it's hot for the body. Kung hindi kaya ng katawan,
So, dapat pala,
you have to, when we say detoxification,
Right.
we also follow the law of nature. Ano ang panahon, anong ibibigay mo. And then
Hindi
what is the
yung-
constitution of the body.
Oo, kasi marami ngayong mga patotoo about supplements and green tea. Dapat hindi ka palabas na nakikinig doon. Best is magpa-consult sa mga katulad niyo po.
Yeah.
Even on drinking simply teas or coffee. Kasi may mga sinasabi sila na mga brewed coffee daw, magaling din for detoxification. Pero what kind of coffee, di ba?
Yeah.
Di ba?
Kasi there were studies that says that coffee in its original form, which is black coffee, is a good antioxidant, which is really true. But the thing is, where did you grow your coffee? Number one, and what type of coffee? And then, was the coffee sprayed with pesticides? Those are the things that you have to take into
Pati
consideration.
coffee, kailangan organic. No?
Yeah.
No?
As much as possible if you can. That's the reason why, diba, there's this coffee from the poo of this,
The cat.
The
Oo,
cats.
which is supposed to be very expensive and very delicious. Hindi ko pa natitikman yun.
kasi nga, it has undergo, parang it has undergo enzymatic process because ininom tapos nilabas. So it has undergone the digestion. So may enzymes na siya. And then whatever toxins that is there, it's already done. So it comes out and then it's really, but if you like the idea, but it's supposed to be delicious daw. But just the mere thought of it.
Pero,
May question
yeah,
ako,
go ahead, Angela.
Kapapasok ko lang, hindi ko alam kung natakal niyo na or what. Yung question ko is, since iba-iba po yung body natin, especially yung mga elderly po,
Yeah.
do you recommend them po to have themselves check muna before they undergo detoxification?
Definitely, kasi in my clinic, before they do any detoxification program with us, we also ask for the mandatory blood testing,
Yeah.
ultrasound, everything, if possible. Especially those with heart ailments.
Hindi lang,
Kasi yung iba, baka hindi kayanin.
Kayanin.
Diba?
Yeah, baka
Baka it's too
mabigla.
much for their body.
Kasi di ba may mga teas na nagpapabilis ng tibok ng puso, may palpitation kang nararamdaman. If for an elderly, that is quite dangerous. So
Yeah.
definitely, no, any supplement siguro or any drinks or any teas na ganyan, before taking it in, better consult kasi ang dami ring mahal na mga ganyan na hindi mo alam kung effective or not effective, no?
So, imbis na wag magsi-self-detoxify.
Oo. Parang medicine lang yan, Dr. Joseph.
Last one. Yung caffeine ba content ng green tea is higher than your regular coffee or brewed coffee?
Depende on what type. We don't really
again.
know unless they will make a declaration. Ideally, kasi nga ang lagi kong sinasabi, whatever that is in the market is supposedly to have undergone some studies. And I would not say anything bad about any product. The thing is, mas importante is, if you want to take a product, be aware of what you're taking. Tapos, if you don't feel good, immediately stop.
Immediately stop.
That's the best thing that you could do. If you don't feel good, immediately stop. And then go back and ask. Kasi more often than not, it's not the product, it's yung pala may problema ka na eh. Hindi mo lang alam. Hindi mo lang alam na may problema ka na. Tapos pag take mo ng product na yun, na-trigger.
Okay.
So, kasi if the product is bad, then everybody that takes your product should go bad.
That's right.
But if it's good for somebody and sa'yo lang, hindi po pwede.
Bakit okay sa kanya, sa akin hindi okay, no?
Yeah.
Parang ganon. Alright, ayan. Ako, napakarami pa po nating napakagandang mga katanungan na naisa ng iba to kay Dr. Lily, pero ubos po ang ating oras. Anyway, meron naman po siyang clinic na maaari niyo pong puntahan. Isa po siyang Integrative Medicine Specialist. At ang clinic niyo, Dr. Lily?
I'm based in Binondo.
In Binondo.
It's Healthy Waste Clinic, room 501P, State Center Building, 333 Juan Luna Street, Binondo, Manila.
Yes, and your telephone number
If
for
you want to come for yung reservation, it's 245-7559. Look for Linda. And then you could also text me through my cell phone. It's 0922-851-3168. I'm usually available in the afternoons right now because I'm attending another course in the morning, which is Human Body Engineering.
Nag-aaral pa rin si Doktora. Okay, maraming salamat, Doktora Lily ko, ang ating guest for today sa pong Integrative Medicine Specialist. Salamat.